Very important. So the selected few who are here could benefit from this. I request you to please settle down as we invite the doctor who's going to guide us through this presentation onto the stage. Ladies and gentlemen, we have Dr. Sarita Rao, who's a senior interventional cardiologist at Apollo Hospitals Indore. She's the only lady interventional cardiologist in central India. She's Fellow of American College of Cardiology, FACC, Fellow of European Society of Cardiology. She's an ex-consultant at Indraprastha Apollo Hospitals, Delhi. She has numerous publications in national and international journals. She has received 7 gold medals during her academic career. She has received Bharat Kashyap Gold Medal for overall excellence. She is also a recipient of Dr. S.K. Mukherjee Award 2016, and she has trained more than 25,000 people in basic life support. Ladies and gentlemen, please welcome Dr. Sarita Rao onto the stage. Let's have a round of applause for Dr. Sarita Rao, ladies and gentlemen, who's going to guide us through BLS, that is basic life support.
Hello. Hello. So good morning, ladies and gentlemen. I would request all of you to please take your seats. So somebody has been giving me a very nice introduction. And I will say that I'm an intervention cardiologist, which means that my job is to deal with people who have heart attacks, people who have cardiac arrests, and I do angiography, angioplasties, I put in pacemakers, I use devices to close holes in the heart. That is basically what my job is. I'm telling you this so you can identify with what I do. Now today I am here to give you a very short demonstration on basic life support. Now why are we doing this? So we had started this program about 3.5 years ago when we two very young individuals who were very close to us because they were not given basic life support. So when somebody who's young, who has a long life to go, who has a very productive life to go, so somebody who's 35, 40 years old has a cardiac arrest and dies because the patient is not resuscitated. It's a very sad day for society. He has got small children on one hand, he's got elderly parents on the other hand. Both of them need his support. So when such an individual dies, it is a great loss to society. Now our culture is such that basic life support is not taught in schools and colleges where it should be. So we are propagating this, that everybody should know basic life support. It has been seen that if somebody has a cardiac arrest outside hospital, the chances of survival are only 5%. But if there is a bystander close by, that is, if one of you or me or him, if somebody does a CPR on that patient, the chances are 60% that that patient is going to walk out of hospital alive and well. So 5% with no CPR, 60% survival with CPR. That is how great is the difference. Ladies and gentlemen, for every 1 minute that you delay in giving basic life support to the patient, in doing a CPR, the chances of death increases by about 10%, which means that in 10 minutes, the story is over. So how are we going to deal with this? Our ambulance in Indore, I know that our ambulance takes at least half an hour to get to any place. But the patient will be dead in 10 minutes. Who's going to save that patient? Ladies and gentlemen, it's going to be you. It's going to be you, it's going to be you who's going to save that patient. And how are you going to do it? This is how you do it. This is called basic life support. Now, basic life support is as simple calling a doctor, as calling a cab. There is only one word that you need to remember, and that is Dr. Cab. DRCAB. Only if today you go from here and you remember only one word, it should be Dr. Cab. DRCAB. What is the word? A little louder. Wonderful. So DRCAB. D stands for danger. You're walking on the road. Suddenly, you see somebody falling down over there. There's a road traffic accident. There's a fire somewhere. You are at home. There's an elderly gentleman, maybe your father, maybe your uncle, your grandfather, suddenly falls to the floor. First thing you have to do is take the person away from the site of danger. वहीं सड़क पे या वहीं घर पे आधे सोफे पे है आधे जमीन पे है वहां CPR स्टार्ट नहीं करना. Take the person away from the site of danger. And how do you do that? You pull the person to the side of the road. If the person is half on the floor on the sofa, don't try to be nice to the patient. You're saving a life. Pull the person down on the floor. The best surface on which you can do CPR is the ground. And the ground is available everywhere. CPR cannot be done on a sofa. CPR cannot be done on a bed. It has to be done on a hard surface. And the one hard surface you will find everywhere is the floor. Okay? So D is for danger. Pull the patient away from the site of danger. Next alphabet which comes after D is? Yes, it is R. So R means check for response. Is this patient actually having a cardiac arrest? Does he actually require this CPR? Okay? Sometimes patients have vagal episodes. Sometimes there are other causes. You have to be sure you're doing the right thing. Check for response. How do you check for response? There are two things. One is the pulse. So, how do you see the pulse? Anybody? Yes, so there is a gentleman there and he held his hand like this, which is very true because when you come to us in the hospital, that is how we check the pulse. But this is an unconscious patient. His blood pressure is very low. This is a peripheral pulse. You won't be able to feel it. So which is the pulse that we feel? We will feel the carotid pulse as you're rightly showing now. Everybody please raise a thumb like this. Everybody one thumb like this. And now feel over here. In the angle of the jaw, you can feel a pulse over there. This is the carotid pulse. Okay? So this is the pulse that you need to feel. Okay? Now, other than pulse, there is one more thing. First of all, when you approach the patient, even before seeing the pulse, you have to hit the patient hard on the shoulder and say,
Hello, hello, are you okay? Hello, are you okay?
right? So first of all, thump the patient hard on the shoulder. Are you okay? You get no response. अगर उस व्यक्ति में थोड़ी सी भी जान है, there will be some flickering of the eyes, some flickering of the face. Don't hit me. Right? But if you get no response at all, go to the next step, check for the pulse. You cannot feel the pulse. You have to check one more thing. And what is that? How do you know this person is alive? Yes, madam, you said like this, and she very correctly said, you have to know if he is breathing. So how do you find out if this person is breathing? This is an unconscious patient. It's not easy. So you have to, 3 words. Look, listen, and feel. Please demonstrate. Look. Look at the movement of the chest. Is it going up and down? Look at the way he's looking at the chest. Is it going up and down? Listen. He's got his ear to the patient's mouth and nose. And feel the gush of air on your cheek. Right? So look, listen, and feel for the breathing of the patient. Now, if you cannot find these 3 things, no response on hitting the patient, no pulse, no breathing, call for help. First thing you have to remember, you cannot do CPR indefinitely. You need help, you need to call the ambulance, you need to call the people who will take the patient to the hospital. Call for help. In Madhya Pradesh, we have 2 numbers for ambulances. 108 is the common number and 1066 is our Apollo number. Call for help. Today everybody has a mobile. If they don't, your neighbor will have a mobile. Call for help. Then immediately proceed to the next alphabet. We finished with D, we finished with R. What is the next alphabet? I can hear few people say it. Everybody? Yes, so it is C. Move to the next step immediately, and C stands for chest compression. And how do you do chest compression? So, ladies and gentlemen, those of you who are right-handed, please raise your right hand. For those who are left-handed, raise your left hand. Everybody. This is going to save somebody's life someday. Right? Now take the other hand and interlock your hands like this. Please remember, elbows have to be straight. If you bend your elbows, you're not going to do the job. Right? Elbows straight, hands interlocked like this. Okay? Now hands down, please. Thank you. So that is the way that you do chest compression. That is the position of the hands. Now, where do you do it? Anybody? Right side, left side? So a lot of people said left side. Now that is a misconception, because popularly, everybody thinks that the heart is on the left side. The heart is a central retrosternal structure. It's right in the center. It points towards the left. So CPR has to be done in the center, where, everybody please touch over here. Touch this sternum bone over here. This is the manubrae sternae. Now touch it here and go down. Where this bone finishes, 2 centimeters above that is the point. Commonly, it is the point between the two nipples. So that is the point that you will do CPR in. Now, when you do CPR, people are going to say, how hard should I press? Now, somebody is going to be, a little shy, a little wary, and is going to do it like this. And somebody who's very enthusiastic is going to go all the way like this. So, ladies and gentlemen, every individual is different. You have to see what is the thickness of the chest wall and compress approximately 1/3 the thickness of the chest wall of that person. Usually it's about 2 inches, so 1/3 of the thickness of the chest wall has to be compressed. Okay? Now, how do we do it? Please demonstrate. So this is how you do the chest compression. I've shown you the point. I've shown you the position of the hands. Now you have to remember, what is the speed? The speed is 100 times in 1 minute. 100 times in 1 minute. What is the speed? Yes, so 100 times in 1 minute. That is how you do chest compression. Now, if you only do chest compression, what are you achieving? We are achieving contraction of the heart. We are achieving the blood coming out. There's pumping of the heart which has started. But is this blood of any use? If it doesn't have oxygen, how is it going to keep the brain alive? Right? So what do? We need to oxygenate this blood. So after C, what is the alphabet which comes? Wonderful. So after C, we have A. A is for airway. So if you have a gentleman who's sitting over here, and I just give a breath in his mouth, the air will come from the mouth and come out from the nose. That is how our airway is made. So A means airway. Please make the airway straight. And how do you make the airway straight? Chin up, neck tilt, and pinch the nose. Okay? So how do we do it? Chin up, neck tilt, and pinch the nose. Now, you will come to the final step, and that is B. B is for the breathing. So once you have pinched the nose, taken the chin up, now you will give 2 breaths. Please demonstrate. So the ratio is 30:2. 30 compressions, 2 breaths. 30 compressions, 2 breaths. Remember, immediately when you have given the breaths, you restart chest compression, and you continue to do this till either the patient shows any signs of life or the emergency medical team from the ambulance arrives. So ladies and gentlemen, this is how you do basic life support. So if anybody ever has a cardiac arrest in front of you, this is how you go about it and you do it. Couple of things you have to remember. Please don't put anything into the patient's mouth. I've seen whenever a person falls to the ground, people are very active, they're trying to help him. A lot of people, they'll take water and put it in his mouth. Please don't do that. the only thing that you can put into the mouth of an unconscious patient is your own breath. Ladies and gentlemen, thank you very much. I hope this helps you someday. Thank you.
Thank you very much, Dr. Sarita Rao.
Thank you.
Truly beneficial, and many misconceptions and myths also corrected. And I think those who are here early this morning, it's been a worthy morning for all of us. So thank you very much, Dr. Sarita Rao. Thank you, Apollo Hospitals. Ladies and gentlemen, we have back on stage Director and Convener of the Rotary Zone Institute, Dr. Bharat Pandya.
Good morning. Good morning. I know we are less in numbers, but our voice can still be heard. Good morning. Thank you. Friends, it's a great pleasure to call this last day of the Dare to Dream 2019 Rotary Institute to order. Before we begin the session, there are few of our leaders who have departed us for their heavenly abode in the last 1 year. May I request the homage PPT to be played, please. And at the end of the PPG, I would request all of us to stand in half a minute silence to pray for the departed souls.